Gastroscopy. Just the word itself can make you feel a little uneasy, right? Well, today we're going to pull back the curtain on this super common procedure. We'll show you how just 10 little minutes can give you so much peace of mind. Okay, let's be real for a second. When someone says gastroscopy, does your brain immediately jump to, well, something kind of scary? If it does, you are absolutely not alone. It's one of those things that just sounds way more intense than it actually is. But what if we thought about it in a totally different way? Instead of some intimidating medical thing, what if you pictured it as a tiny, high-tech detective, a specialist that goes in to solve the mysteries happening inside your digestive system, looking for clues that nothing else can find? So what is a gastroscopy anyway? The fancy name is upper GI endoscopy. But really, all it is a procedure where a doctor uses this really thin, flexible tube that has a camera on the end. It lets them get a direct look inside your esophagus, your stomach, and the very first part of your small intestine. Honestly, it's the best, most reliable way to see what's actually going on in there. And I know, when you hear the word tube, you might be imagining something big and clunky. But the reality is, this little detective is super slender and flexible. We're talking only about 1 centimeter across. It was designed from the get-go to be as easy and non-intrusive as possible. So what kind of clues can this detective find? A whole lot, actually. Its power is incredible. It can spot inflammation, things like esophagitis or gastritis. It can find ulcers, polyps, and this is the really big one, it can detect the earliest signs of cancer, right when it's at its most treatable stage. All right, so we get the what and the why. But what's it actually like to go through one? Let's walk through the whole thing, breaking it down into 3 simple parts: before, during, and after. When you know exactly what to expect, the whole thing feels way less intimidating. Think of this as the game plan. It all starts with a little bit of prep, then you have the procedure itself, and it wraps up with some really simple aftercare. So let's kick things off with step 1. Okay, step 1, preparation. And trust me, this part is super easy. Basically, you just don't eat or drink anything for about 8 hours before. And why is that? Well, it's pretty simple. An empty stomach means the doctor gets a crystal clear view. Then, just before you start, they'll give you a quick anesthetic spray on your throat to make sure you're comfortable. And now for the procedure. You'll just lie down on your left side, nice and comfy. The doctor will gently guide the scope, and they'll ask you to do a little swallow. That just helps it go down smoothly. Now, this is the part people worry about. And yeah, there's a moment of discomfort, but I promise you, it literally lasts for just a few seconds. The most important thing you can do is just breathe, slowly in through your nose, out through your mouth. And hey, if you feel any real pain, you can always signal the staff. Just don't grab the tube. And just like that, it's over. The aftercare is a breeze. You'll just hang out for an hour or 2 while that anesthetic wears off. You'll start with a little water, and then you can move on to some soft foods. It's totally normal to have a bit of a sore throat for a day or 2, but it goes away really fast. So that's the whole process, from start to finish, pretty straightforward, right? So the next big question is, who should actually be getting this test? It's not for absolutely everyone, but for certain people it is an incredibly important and maybe even life-saving part of staying healthy. So who is this for? Well, it's highly recommended if you're over the age of 40, just as part of a regular health screening. It's also really, really important if stomach cancer runs in your family, if you've had ulcers before, or if you're dealing with symptoms like ongoing abdominal pain for more than a week, or if you notice black stools. All of these are major signals that it's time to get a closer look. So, while it's a great tool for people with those risk factors, there are a few exceptions. It's generally not done on patients who have really severe heart or lung disease, some specific issues with their esophagus, or for anyone who just isn't able to cooperate with the simple steps. And that brings us to the biggest takeaway here. It's time to change how we think about this. A gastroscopy isn't something to be afraid of. It's a proactive choice you make for your health, and, just as important, for your own peace of mind. And how long does this big, proactive step take? For a typical diagnostic check, we are talking about just 10 minutes. That's it. 10. From the moment it starts to the moment you get clear answers. One source I read put it perfectly. It said, give the doctor 10 minutes, and in return, you get health and peace of mind. What a trade-off, right? A tiny bit of your time for something so valuable. So that's the question we'll leave you with. 10 minutes. 10 minutes to either catch a serious problem when it's easiest to fix, or to get the all clear and just stop worrying. When you think about it like that, Isn't your health worth 10 minutes?